Okay. Hello, exposed healthcare people. So this is the third time I'm experimenting with this LinkedIn, basically shouting out my different connections and what they're saying about healthcare. I got some good feedback on my last one from different people, so I'm just gonna roll with it and keep on trucking, keep on trucking. So let's start off with this guy, Shane Jeromonsky, really funny guy. This guy is the accidental pharmacist. He has like a bunch of followers on Facebook and Twitter and stuff, and he's leading one of the leaders in the unionization of pharmacist movement through the Pharmacy Guild. So he's going to be on NPR within the hour. So this is breaking news. Although by the time you watch, it's not going to be that breaking. Um, he's going to be on NPR talking about the looming pharmacy crisis in America. All right. Next. Microsoft is bringing generative AI to its security products. I'm not sure if I can give a healthcare spin to that particular, but I know for healthcare there's a lot of AI opportunities. I just wrote a course on AI in healthcare, and a lot of opportunities, especially with CDS, clinical decision support systems, and those are basically systems that would allow a doctor to accumulate a bunch of information and to come up with a certain decision, like which antibiotic to prescribe, um, based on a bunch of data put together, and then AI, processing it. Um, and as far as security, I'm not gonna even try to relate that to healthcare. Let's see. Let's go next. Let's go next. 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 Not healthcare. Not healthcare. Not healthcare. Okay. Let's see. I didn't want heavy painkillers after surgery, but my hospital pushed opioids on me anyway. Oh man. So, Tiffany Ryder, former NFL cheerleader, writes, too often we are comforted and flattered into forgetting that those words are a misnomer and that they feel the illusion that our level of education and training somehow equates to the right and the ability to control well everything, medical experts. Paternalism in medicine is alive and well. As Christy and Price Platt remind us in their post this week, paternalism is baked into our hospital protocols and our treatment guidelines. It is at the heart of over-testing, over-prescribing, and over-treatment. It fuels actions taken in the spirit of defensive medicine and is behind practices justifies as evidence-based medicine, but it's not without consequences. The, as a father, I take offense to paternalism. Just kidding. This compelling USA Today article by Emma Fox reveals what paternalism can look like from a patient's perspective. No, 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 I really didn't understand just how painful this surgery would be. Pain management was a patient right. Painkiller refusal, it seemed, was not. Nearly half of doctors admitted to prescribing inappropriate narcotic medication because of the incentive to acquire higher satisfaction scores. Um, so, for those that don't know, um, hospitals will be paid based on satisfaction scores. So, if they have a lot of patients that are in pain and they say they're not satisfied, that could affect their reimbursement and um, their star ratings, which is another way that they get reimbursed through insurance, Medicare, Medicaid. So they'll push it. And I saw this firsthand with my friend. My friend had a kidney stone and he was in the emergency room, and the doctor and the nurse practitioner were basically shoving it down his throat. My friend was asking me because I went with him, and as a pharmacist, he was asking me, "Do I need it?" And I asked him, like, "How much pain are you in?" And he said that after the Toradol or the anti-inflammatory medication that he took, he was basically in no pain. So I told him, like, there's no reason for you to take an opioid if you're not in pain. He told that to the doctors, and they basically were like, "Are you sure? Are you sure? Are you sure?" It was crazy what I was witnessing, and especially at the time, this was pre-pandemic. At the time, there was only the opioid epidemic, and I was like, "There's an opioid epidemic, and you're shoving like narcotics down people's throat." This kind of explains why. Um, The surgeon in this account was respectful and attempted to follow the patient's wishes, and yet the system wasn't designed to allow for it. It's worth reflecting on the mistakes of our past, just as the opioid crisis, as we attempt to solve new challenges. So crazy. Kristen Spear, one of my great connections that I have. Big egos harm patients, not only by overdoing it, as you mentioned, but also by underestimating, under consulting their interdisciplinary team members. Yeah, so that's a shout out to pharmacists working together um, with doctors and nurses and kind of figuring out. Deep prescribing is a big movement right now. There's a lot of over prescribing because of defensive medicine, and I'm also in surgeries. I am with surgeons. And I interviewed two defensive medicine, two doctors, two surgeons regarding defensive medicine, how that impacts patient care, and it does not always lead to good outcomes. It leads to over testing, over prescribing. No bueno. All right, so Tyra Schneider is pretty cool. She used to be a point of care expert. I guess she still is a point of care expert. And then her and her husband, they opened up a pharmacy, and she's providing pretty cool updates to people, to the community. So, pharmacy update. I promised the ugly with the good. I had a patient be extremely disrespectful and harassed not only to me, but my staff last night. Her medication required a new coupon with every fill, unknown to me, and of course, her insurance didn't cover it at all. She called multiple lines, tying up calls coming through, yelled at almost everyone in the pharmacy while I tried to get her a coupon. She also told me she was a nurse practitioner. She does not fill medication for any of my patients. She's a telehealth nurse. She's also an adult and should know better than to behave like a 2 year old. I have a 2 year old, so yes, people should not behave like 2 year olds, adults. I told her I would not fill any medication for her. Again, full stop. I will not tolerate anyone treating my staff that way. This is not a big chain. I get to have a respectful environment. Question: do anyone have a sign that I can use as a template to draft my own no harassment staff policy? Also, we will not be doing any controlled drugs from telehealth providers. This is shady, and frankly, I don't think you can establish a patient relationship 2,000 miles away. Any guidance on a policy there? I love my staff and I want to create an amazing environment where they're treated with kindness, respect. So, first, harassment policy. Um, the way I did it is no cursing and no yelling. And if someone yells or curses, I wouldn't just like kick him out. I would basically give him a warning and be like, uh, listen, you cannot yell or curse at me or our staff. That is not tolerated. And if they continue to do so, then they're gone. However, most people actually take that like barrier, and they take it well, um, and they generally stop doing that. As far as controlled substance telehealth providers, very simple. And I had this policy written up. Uh, Patients and doctors both have to be either in your town or a bordering town. Now, that applies in suburbia where town means something. If you're in a big city, it's going to be a little bit different. Then you could use some kind of like mileage. You could use some kind of like minutes, whatever, on Google Maps, something like that. This like you want to create this radius, because Tara's right. If you have a doctor in California prescribing for a patient in New Jersey, and you're supposed to take care of that patient, especially if that patient is from like many, many towns over or cities over, why are they coming to you? It's already shady. So the policy that I put together at my previous pharmacy that I was running was same. The doctor and the patient both have to be within the same town or bordering town, and I wrote down the towns so that way it would be clear. Okay, so that was great. I like that. Next. What do you notice about this map on life expectancy in the US? What conclusions do you make? I wonder. So the conclusions I would make is there is a relationship between obesity and life expectancy. First of all, if you look at this area over here, that's your Alabamas, your Mississippis, South Carolinas, the Georgias, all those kind of stuff. Tennessee, you have high obesity, high diabetes rates, and low life expectancy, obviously. Um, Poverty as well is there. Um, I recently, with my wife, watched a thing about blue zones, which are areas with very high centenarian rates. And surprisingly, an area of California had one of the highest rates, and it was because of the involvement of the Seventh day Adventist Church, which prioritizes health and moving, and people moving, either through exercise, volunteering. So, move. And I had a video recently about even moving 1 minute a day. It decreases all sorts of crazy statistics like heart attack, stroke by 50%. So, CVS wants to create a healthcare super app. Okay. And Brendan Cahill, he's part of this initiative. Woo! This is my buddy. I used to work with him and go to school with him, and we were roommates in college at University of Rhode Island. What is the super app? Okay, super apps, so-called everything apps that combine multiple services in one platform, haven't taken off in the US, but CVS is angling to change that. CVS wants to create a super app connecting multiple omni-channel modalities for the healthcare experience, including benefits, delivery, and retail channels. Chief Medical Officer Sri Shagutaru said today at the health conference in Las Vegas. A super app is a widely adopted mobile or web application that combines multiple services in one platform. Super apps are ubiquitous in Asia but haven't taken off in the US due to a fragmented app network, concerns about advertising revenue, the country's payment system and structure, and a regulatory environment, according to the Harvard Business Review. As we think about the future of healthcare digital applications, we won't have a super app the way that we have in other countries that crosses multiple sectors, but we do believe that there will be a role for super apps in particular verticals. We think we're well positioned to create that sort of super app for healthcare. Following the multi-billion-dollar acquisitions of value-based medical group Oak Street Health and home health provider Signify Health this year, CVS been focusing CVS been has been focusing CVS been focusing on ways to integrate the functionalities of its different businesses to cut costs as the company pursues a larger restructuring. In pharmacy, for example, CVS created a new segment this year that integrates all of its pharmacy capabilities, including retail pharmacy, specialty pharmacy, and mail order pharmacy, as well as infusion services. Oh, interesting. CVS surpassed 50 million digital customers, a significant milestone. CVS says that its customers and members of its health insurer Aetna frequently engage with the Rhode Island based company via digital application and text messaging. According to Chaguturu, CVS sent 2 billion text messages in 2022 for a variety of reasons, including confirmation of healthcare appointments or medical information. So that would be interesting. Always skeptical of what CVS does tech wise because I had a really bad experience with their technology when I was working there for over 10 years. It was a lot of high expectations and low execution. So hopefully they will turn around things with that. There is a lot of opportunity. However, it is also a lot of opportunity for these vertically integrated companies to wreak havoc on the cost of healthcare with negative impact on patient care. It is Yeah, there's a lot of evidence for that this vertical integration is not good for patient care and will just lead to profits for companies like CVS. So, skeptical from a technology perspective and also from a patient care perspective. Um, that's it for now. I would love to see your comments on what you think about these different things that I talked about and also on this format in general. Peace.